Hey guys, it's Dr. Kavicki Miller from Spare Family Medicine. So I am seeing a lot of viral gastroenteritis, so I figured we would talk about that today, what it is and what you can do about it. So viral gastroenteritis, or vomiting and diarrhea, is just basically inflammation of the lining of the stomach and the small and large intestines due to a virus. So we're all familiar with the symptoms: nausea, vomiting, diarrhea, low-grade fevers, chills, cramping, belly pain, and symptoms can sometimes take up to 48 hours after exposure to present, and they can last up to a week, although most commonly they get better in 1 to 3 days. The most serious complication would be dehydration, right, from all that vomiting and diarrhea. Infants and older adults really need to be watched for this. Symptoms include like dark colored urine, infrequent urination, dry skin, right? If you pick up the skin and it doesn't go right back down, that can be a sign of dehydration. Lack of tears when crying, sunken eyes. Other reasons to seek help would be if you're noticing things like blood in the stool, severe symptoms that persist, or severe abdominal pain, persistent high fevers. Basically, if you're unsure, call us, right? We want to help, and we have things that we can do to help you feel better. And we would rather know what's going on. Most of us, though, will ride this out at home, right? And so what do we need to be aware of in order to do that? So the very first thing is, in my book, is I don't want anybody else to get sick. So let's talk about how to prevent spread. So viruses are spread through contact with infected stool or vomit or surfaces that have been contaminated with those things. So you want to make sure that you're washing your hands, especially anytime after you vomit or have diarrhea. You want to make sure you're putting the lid down on the toilet when you flush so that all that virus is not getting spread into the air and onto the surrounding surfaces. You want to avoid sharing food, drink. You want to wipe down the bathrooms regularly with a bleach mixture or with a bleach-based cleaner. Kids should stay home for at least 24 hours without symptoms, and we should all be aware that we can shed virus for up to 2 weeks, even after we feel better. So make sure that you continue that good hygiene even once you are feeling better. So what are some things that you can do to stay hydrated and feel better when you are sick? So you want to push fluids as much as possible. And this can be anything from water, diluted juice, right? Because full strength can actually cause diarrhea, sports drinks, soup, popsicles, any form of liquid, right, is going to actually help. Pedialyte is an option that some of you guys may be familiar with, and if that's too bitter or your child doesn't like the taste of that, you can add some flat ginger ale to it as well. You want to sip small amounts until you're tolerating more, and then you can increase it. You can also suck on ice chips if somebody's especially very nauseous and just is having trouble getting fluids down. You want to make sure you're getting plenty of rest, right? Your body needs that in order to recover. And when you do start to eat again, most of us are familiar with the Bratz diet, which is that bananas, rice, applesauce, toast, and saltines, which can help to settle our stomach, firm up the stool. But one thing that most people aren't aware of is that you should avoid dairy for at least a week or two after a viral gastroenteritis, because you can develop a temporary lactose intolerance just because of the inflammation that's still in the gut. So if you do drink dairy products or eat something that is a dairy product, you can get more gas and diarrhea, and nobody needs that. So I hope this is helpful. Stay healthy and have a great weekend.